Hi guys, today I am going to talk to you about an important social issue to me, and it's vaccination gaps. Vaccination gaps, they happen when people don't get the vaccines that they need, whether it's because of access, cost, beliefs, or like misinformation. This can lead to outbreaks, the measles, like we're seeing today, and just other preventable diseases. Time to go away. Okay, who this affects? This issue, it mostly affects kids, low-income families, and people with health conditions that kind of prevent them from getting vaccinated in the first place. But really, overall, it impacts entire communities, states, countries, because when fewer people are vaccinated, everyone's at a bigger risk. Some history behind vaccines. Vaccines have been around for hundreds of years, but vaccine hesitancy really grew after a false study in 1998 claimed a link between the MMR vaccine and autism. This study was proven wrong and it was retracted, but the effects we're still feeling today. During COVID-19, our trust really dropped in vaccines. A lot of people started bringing this paper back up, not the retracted part of it, but now it's leading to more measles outbreaks. This is some of the information on measles outbreaks. We've had about 712 cases already in 2025. You can see about 32% of them were under 5 years old, and 97% were unvaccinated or unknown. And in 2024, we had 285 cases, with 42% being under 5, 89% being unvaccinated or unknown, and a 40% hospitalization rate. We do have a law in Nebraska that requires kids to have vaccines before they can go to school. It makes some exemptions, medical and religious regions, but some people are abusing it. I think we should keep medical exemptions, but make religious exemptions a little harder to get, maybe by requiring some type of official documentation. Another idea of mine is to add mobile vaccine clinics at school signups, like a kindergarten roundup. Make it a little bit easier for those busy families. Here I have a vaccine schedule, and I just want to say that we need to protect each other. We need to share this real information, all this data that I showed you. Talk to your doctor, ask those questions, help out your friends and family, and tell them why these can matter. Share this chart with others and kind of make sure people are staying in check with what they need to get and when. And education is key. You can be a part of the solution. Let's close this gap together.